Well, the key finding really starts with our national grade. And as a country, the United States got a D plus on the 2025 report card. That grade reflects our preterm birth rate, so 10.4%, or 1 in 10 babies in this country being born prematurely. That grade of D plus has been where we've been stuck for the last few years and not where we want to be moving forward. So really, we hope this report card is a call to action. What I would say also is that as you dive into the report card, there are a number of other indicators that are important to look at, whether those are infant mortality or severe maternal morbidity or maternal mortality or inadequate prenatal care, initiation of prenatal care. The report card is really a rich source of information that is a helpful roadmap for how we think about improving birth outcomes in the United States. Well, let's start with preterm birth. When we look at preterm birth, again, just over 10% of babies in this country born prematurely. That's the overall number. We know that just like with many other maternal and infant health indicators, as you start to peel back the layers, what you actually see are marked disparities, particularly if you compare non-Hispanic white women or babies and non-Hispanic Black mothers or babies. So whether we're talking about preterm birth or maternal mortality, we also see worse outcomes for non-Hispanic, American Indian, Alaska Native women. And so those disparities are pervasive. They've been pervasive in this country for centuries. And as we think about improving overall rates, that's an area where we need to focus. Now, you ask about any of the other indicators. So, for example, we talk about infant mortality, the rate of babies dying before their first birthday. That rate was relatively flat at 5.6. That means 5.6 deaths per 1,000 live births. I often find that when we're talking about rates, it's helpful to translate that into something maybe more meaningful. And so that rate of 5.6 translates into over 20,000 babies every year dying before they reach their first birthday. And as you pointed out earlier, there are also marked disparities when it comes to infant survival across the country. In terms of some of those other statistics that are in the report card, we talk about prenatal care. So we talk, for example, about early initiation of prenatal care. Ideally, folks would start prenatal care in the first trimester, and they would continue on a regular course of prenatal care throughout the pregnancy. And so we measure that in a couple of ways. We measure the percentage of pregnant people who start prenatal care in that first trimester. That number has unfortunately gotten worse. So over a quarter of pregnant people did not start prenatal care in that first trimester. We also measure something called adequacy of prenatal care, or you can look at the converse of that, inadequacy of prenatal care. And that's based on both the timing of when a person starts prenatal care and also the expected number of visits. And what we found is that that number has also gotten worse. Now we're up to 16% of pregnant people who don't get adequate prenatal care. And so when we think about birth outcomes, whether we're talking about preterm birth or infant mortality, severe maternal morbidity, or even maternal mortality, we know that access to care is really important, not only during that prenatal period, but even before. And so at March of Dimes, we talk a lot about access. We've got our maternity care desert report highlighting those areas of the country where there are not OB services and there are no labor and delivery facilities. Those are vitally important as we talk about improving birth outcomes. But all of us know that we can't improve birth outcomes without thinking about the health of pregnant people across their life course, even before they become pregnant. So we really need to think about making sure that folks have stable access to insurance and that there are places they can go for healthcare in their community.